Many thanks. It's a great honor to be with a wonderful panel today and part of this event hosted by Norad. So, as we've heard from Dr. Tedros, the wealthiest nations have secured billions of doses of COVID-19 vaccines, while many low and middle income countries struggle to access supplies. That has led to something commentators are calling vaccine nationalism, where countries push to get first access. Completely understandable. I'm sure we are all surrounded by people terribly anxious to receive their first doses. That said, the world has constructed the Global Vaccine Alliance, Gavi, and built COVAX to respond to this. And CEPI has put so much effort into bringing these important vaccine candidates to the line for approval and distribution. So we have a great panel to discuss these issues. We'll first start, we've been rejoined by Minister Dag-Inge Ulstein, and we're also honored to be with Dr. Tadesse, who's the Minister of Health of Ethiopia, Dr. Norheim from the University of Bergen, very experienced both internationally and in Norway, with the hard decisions that we have to make in terms of who gets what and what rules we should follow, and Dr. Richard Hatchett from CEPI. So we'll ask our panelists to start with a short reflection, and then we'll have a bit of a conversation. So let's go first to Minister Ulstein. What are your thoughts on this issue of vaccine nationalism and what we should do about it?
Thank you so much. I think we all see that there is such a crucial point now, and there is a moment of truth for many governments, but there are also very difficult discussions, and there are many nuances also in this, because in the same time that we have a lot to thank the vaccine industry, the researchers and the others, because of what we've achieved in such a short time. At the same time, there's a huge responsibility, both on the industry, but also on the wealthier countries with the possibility to continue to invest and to close this financial gap. Because again, we know the consequences if we'll reach the goals that are set. That would just make continued suffering. That will also make us to decrease and to undermine the trust and the incentives for working together in future crises also. So I think that Dr. Tedros said it very clear that we need to mobilize not only the finances, but we also need to see more countries share their vaccines, because now it's 20% that are covered through the COVAX facility. And we need to increase that also. So again, it's really challenging times for many countries. But in the midst of this, we really need everybody to understand that we will not help our own citizens without actually working through the global mechanisms.
Right. There's so many issues here, because I think we all hope that maybe 20% coverage each would be enough to reach herd immunity. And we're now seeing, especially with the new variants circulating, that countries will need much more coverage to be able to defend against the disease. Let's now turn to Dr. Tadesse. You're leading the Ministry of Health in Ethiopia. What sorts of issues do you see as you think about your vaccine supply going forward?
Thank you very much. It's a pleasure to join this panel and this critical topic. And a lot has been said by Dr. Tedros and also Minister. I would first like to start by recognizing that really within this pandemic, the world has never seen such a huge global research and development effort, which has enabled to fast track the vaccine production and bringing it into the market. But with such huge achievement, still the challenge of really distributing to those who need it most in an equitable way is I think, the biggest challenge we're all facing. I mean, even before the vaccine has come into place, even when we were responding for the pandemic, we have seen that every country definitely has been focusing on their own in the beginning, and the advantage between what the haves and the have-nots has been significant. And within the current one, in terms of the vaccine distribution, I think it was clearly laid out. As we speak now, many countries have started vaccinating their population. I think more than 53 countries as of now, and we know none of them are in Africa. And the COVAX facility has been established to really solve this precisely, and with a really clear vision of ensuring equitable and timely access to the vaccines to all. And now, when we look at it, the concern now is when will this priority populations all over the world get those vaccines? Because some countries are accessing even for less priority populations, while other countries, the key priorities are also not being addressed. But huge work has been done through the facility with coalitions through CEPI, WHO, Gavi, to really put the facility up and running and ensure the doses and the finances have been secured. But now it has to be really seen on the ground. The concern is that it has to be seen on the ground quickly to ensure that, as we all repeatedly say, no one can be safe until all are safe. So I'm really hoping that countries will continue to commit supporting these coalitions, the facility, to ensure that there is equitable access to the vaccines.
Thank you, Dr. Tadesse. I mean, we do have to take a moment and say, before Gavi, I think the average time between when a vaccine was introduced in a high-income country and when it reached low-income countries was 15 to 25 years. So here we're talking really about a matter of weeks. So I mean, of course, we're living each week like a year. I know that. But on the other hand, COVAX is projected to deliver vaccine in February. I think we should take a moment to appreciate that. I know everyone's under enormous pressure, so but we often aren't grateful for all the great things that are happening. Can I just ask one follow-up question to you, Dr. Tadesse? I mean, we've seen the African Union, the African Medicine Supply Platform, announce a purchase on the side. That's completely understandable, given that we need high levels of coverage. We would expect to see more. Is that a bad thing, or is it just a natural thing that's going to happen alongside COVAX? And how should policymakers think about this?
Yeah, I strongly also think that needs to be really coordinated through the mechanisms that are globally laid out. It doesn't have to be competing with each other. It is understandable that the challenges are out there, and different mechanisms may be needed along the way, but it should be really aligning, and I think the efforts are also there to make sure that it's coordinated through the global mechanism and not in separate manner.
Thanks, Dr. Tadesse. So now speaking about who gets what and how to decide, let's turn to you, Ole, to reflect a little bit on how these distributional decisions could be taken. What are your thoughts on that?
Yeah, I'll just make three brief points. I'm a big supporter of COVAX and fair global vaccine distribution. And you're right, the low-income countries might get vaccines much quicker than we saw before with the pneumonia vaccines and rotavirus vaccines, etc. But as Dr. Tedros reminded us, very few jabs have been set yet in COVAX countries. Rich countries could have done much more. So I want to reflect a little bit on what can we learn and what would a better mechanism be for improvements and for the next pandemic. I think there are 4 principles that we need to establish. We need a mechanism that will optimize innovation and production. And we have that to a certain extent. We need a sustainable mechanism that will have the right incentives for the industry to contribute also in the next pandemic. And we need fair distribution based on need. And finally, accountability. It's about accountability about agreements, about prices, and the bilateral deals and the deals with COVAX. So I think a better mechanism could be negotiated among all WHO member states, partnership between the industry, multilaterals, and individual countries, with a core of a binding agreement on caps on bilateral agreements, say 70%. Sold according to willingness to pay. and rich countries and the pharmaceutical companies would agree that a proportion of vaccines, say 30%, should be reserved for COVAX from the start. And COVAX would guarantee fair distribution among eligible countries at lower or marginal production cost. And this, in conclusion, would be international cooperation at its best. It will secure optimal innovation and production, sustainability, fair distribution, and with accountability as a mechanism to make it work. Thank you.
Can I ask you just a follow-up question? How would you hope to see that brought together? Do you envision a summit where countries would come and agree, or what are you thinking on that?
Yeah, I think countries need to come together to agree on that, and at least agree on what to do in the next pandemic. I think if we prepare and agree beforehand, it's easy to see that a proportion of vaccines should go to the poorer countries at lower cost, and there's a lot of willingness to pay for the rest for the rich countries. But we need to secure a fair distribution. What is urgent now is to follow Norway's lead to give vaccines that they have already purchased to COVAX.
I agree, and I think it's so much a timing issue as well, because there is this constrained manufacturing capacity, and our speed and response is what matters. Let's now turn to Dr. Richard Hatchett. CEPI has really been such a good news story as part of this very difficult time. But I did see this morning some discussion about whether ODA or aid should be used to finance global public goods like vaccine development, when we know that the benefits of the R&D that is done benefit both wealthy countries and low and middle income countries. Obviously, it's a nuanced question, but can you reflect a little bit on what this discussion means for your work at CEPI? What are the implications for financing global public goods in the future in this space?
Sure. No, thank you, Amanda, and thank you to Minister Ulstein and to Norad for the opportunity to join the discussion today. So CEPI's financing, we do receive overseas development assistance funding. It is a significant fraction of the funding that we receive. It's not the only source of funding. We also receive funding from research agencies and even some through biosecurity channels. So CEPI has always represented a mix of funding, but CEPI's contributions to CEPI currently are considered 100% ODA eligible. And the rationale for that is that emerging infectious diseases have principally emerged in developing countries and principally affected the populations and economies of developing countries. Obviously, when they are translated into other settings, they can cause tremendous damage to very developed countries. One example being an outbreak of MERS in South Korea in 2015 was estimated, a very small outbreak, less than 200 cases, was estimated to have caused around $10 billion of damage. I think in the context of a pandemic where the disease is everywhere and is affecting all populations simultaneously, the simultaneity of need creates an absolute imperative for CEPI, which as an organization, our principal focus has been on developing vaccines against diseases that prior to COVID principally affected developing countries, and working with those countries to be prepared to respond to new epidemics. But in responding to a global pandemic, we had to widen our remit. But core to CEPI's mission, and I think to the discussion today, our mission statement says that we develop vaccines against emerging diseases and we ensure access to the populations that need them. Pre-COVID, that principally meant populations in developing countries. During COVID, it means globally. And so we have used our R&D investments, and I think this is an important thing to understand about COVAX in the context of all of the bilateral deals that have been occurring that Dr. Tedros mentioned. We've used our R&D investments actually to secure access for the facility. So the major investments that CEPI has made have resulted in access agreements, right of first refusal for COVAX. So these are doses that are essentially taken out of the market. They can't be bought up by other countries, and they are there for the facility to use if the vaccines prove to be effective. And fortunately, many of the vaccines that we've invested in have, in fact, are in the first wave of vaccines that are crossing the finish line. And last week, we were able to announce that we had secured about 1.8 billion doses of vaccine. And with the additional right of first refusal, we think that we will have close to 2.5 billion doses that are available in 2021. And we've posted these vaccine allocations on the Gavi website. So you can see month by month how the vaccine supply will flow out. To come back to your question, I think the vast majority of the doses that will flow through COVAX now are going to serve the needs of developing countries. And I think that makes a very strong argument that the R&D investments that CEPI has made are directly going to provide benefits to developing countries and disproportionately provide those benefits, and in fact have secured a very substantial portion of the doses that will be available for those countries and so should be ODA eligible, which I know is a kind of a nuanced policy point, but it does speak to how we've decided to structure COVAX and how we have structured our R&D collaborations.
Yeah. Thank you. One other question that we had on our list that I think you're best placed to answer is sort of the role of industry in the development of production of vaccines. And you've talked a little bit about how CEPI's R&D investments led to the ability to reserve doses. Are there other considerations to make negotiation tools that we have here? There's some discussion about whether, one company has promised some amount of doses, but maybe they'll postpone that delivery and deliver to someone who's given them a higher price in the meantime. Are you worried about that kind of dynamic on the industry side?
Well, I think Dr. Tedros has spoken to the intense scramble for vaccine doses now, and he's issued a clear moral call to all participants in the system to live up to their commitments. And I think, yes, if people choose to operate beyond their commitments or operate outside of their commitments, that kind of bad behavior could manifest. And the more frantic the scramble for doses by individual countries seeking to protect themselves and not remembering that we are all in this together, the more likely such bad behavior is to emerge. I think we need to remember that the reason we have made this massive global effort to develop vaccines is to end the pandemic. And countries cannot end the pandemic by just vaccinating their own populations. We can only end the pandemic if we ensure that the vaccines are distributed globally. And while vaccine is a scarce resource, make sure that it is given to those for whom it will provide the greatest benefits. And that means healthcare workers and those at greatest risk of severe illness or death globally.
So, Minister, building on that point, let's come back to you and maybe Dr. Tadesse as well. As we think about trying to make that vision a reality, what do you see as the political realities? Of course, everyone has their domestic constituents to respond to. You can imagine, well, here in the United States, the state level governments are starting to pressure the federal government to be able to buy on their own. There's some, small regulatory issues, so they can't, but, the intent is there. They're under enormous political pressure. How should we think about this? What would you advise? Do we need to think more about political messaging that politicians could use to speak to people?
I think we have such a great opportunity now to see this very close link between development and wealth and the situation in our own countries. This is not only about international solidarity. This is very much about self-interest, and that's not that often something that I speak a lot about. But I think we can use that momentum right now and to make sure that this is not only like something for the development people working in Norad and in other Ministry of Foreign Affairs, but this is something that the finance minister, the macroeconomic perspectives in this, the large companies, they should really see that time to actually step up and say that the financial gaps, 4.5 billion US dollars, that is something that we can fix today in the boardrooms, and to make sure that that is not the discussion, because there are so many laps in this, the last mile, to make sure that there is enough trust in the societies, actually, so that we can make sure that we reach out to the furthest behind in developing countries. That is really important for us to get back to a more normal everyday life in our communities. So that link, there's a really good opportunity now to actually make that statement and have that as a very clear message. And I really hope, unfortunately, I would really hope to see that we could see more vaccine doses getting out to the low and lower middle income countries. But at the same time, when we see things evolve here in our communities with the virus circulating and new mutations coming up, that is such an important time to understand that we will never fix this if we are so fully vaccinated our own population. We need to engage and to make sure that these global mechanisms will succeed. So I think there's a huge opportunity now, and we have a meeting actually later on this week. Norway, South Africa, together with other G20 countries, finance minister to actually address that. And I really hope that we will see many governments stepping up, not only with words, but actually put the money on the table and to actually start sharing the vaccine doses also.
Dr. Tadesse, we'll give you the last word. How do you cope with the difficult politics? What would you advise your counterparts in other countries? How should they speak to their own populations on this issue?
Thank you. I think, as we have seen even in the response to the pandemic itself, solidarity, international global solidarity has played a huge role in really containing, mitigating all the impacts of COVID since the beginning. And the same applies now, and even much more, because solidarity in vaccine introduction and distribution really would eventually have not just health gains, but economic gains for all of us globally. And I think governments especially need to come on the same page and need to really have the same voice in this regard and come together to pursue and support these global mechanisms that are already created. And I think the what's happening so far, the challenges are really understandable, as was said, and the progress is huge, but we should build on what would take us more further and support these global mechanisms, especially with the leadership of all governments. Thank you.
Thanks, Dr. Tadesse. Actually, I think we have a couple of minutes more, so I'll just ask, Ole, you have coped with the difficult politics of priority setting in Norway, in your own country. You've worked a little bit in Ethiopia, working with policymakers there. What do you see as a key next step to implement this vision?
It's hard to say. I think we should kind of end on an optimistic note that, compared to the usual way vaccines and other new technologies are rolled out in low-income countries, this is much, much better than before. So I think Ethiopia and other countries should start preparing for rolling out the vaccines and be prepared to protect their communities. So I think we should also acknowledge that CEPI and Gavi and the COVAX facility has achieved something that was thought impossible a few years ago. So even if it's not perfect, I think we should end on this more optimistic note.
Absolutely. And, it's possible that in a month and a half's time, maybe vaccination goes well in high priority groups, cases fall, and sharing surplus won't seem like such a heavy lift. Richard, any final thoughts as we wrap up?
I just want to build on Professor Norheim's historical perspective. COVAX was built reflecting on the experience in 2009 when over a year only 78 million doses were shared globally with developing countries. It certainly represents an improvement to that. I really appreciated his thoughts about how we take and learn lessons from COVAX and move forward and create even better mechanisms in the future. So I'd end on a positive note as well. Thank you.
Okay, so with that, I think we can wrap up this panel. I believe there is a break for a short video, and then we'll be back to talk about the interruption to essential health services during the COVID-19 crisis. Thank you to all the panelists.